Hello everyone. Welcome. Good morning, good evening, good afternoon, wherever you are across the world. Welcome to the first online Philippine Harm Reduction Summit. My name is Jake and I'm your moderator for today. Our topic today is very timely as there have been intense debates on journalism ethics. Recently, a journalist has been criticized online for asking what some had perceived to be an unethical question during an interview. Ladies, gentlemen, people of diverse SOGSC, this is De-Stigmatizing the Media, Tips for Covering Harm Reduction and Drug Policy. Our speaker is a freelance journalist and researcher living in Chicago. His articles, which are recognized for bringing nuance in the conversation of drug use and drug policy. They have been appeared in the New Republic, uh, the Nation, the Atlantic, and the New York Times Magazine, to name a few. He is currently a journalism and fellow at Northeastern University's Health and Justice Action Lab, sorry. Please welcome Zachary Siegel. Hi, Zach. Welcome.
Thanks for having me. Hello, everybody. My name is Zachary Siegel, and I'm a journalist and researcher. I'm really excited to present on my work covering drug use and addiction in the US. And I'll be talking about really how my goal has been to destigmatize the language of addiction, to inject a lot of humanity and compassion into this topic. It's desperately needed. So yeah, I have a lot of slides. I'm just going to try to speed through them, go quick, and hopefully this is informative and educational and entertaining. I don't often do presentations. I'm a writer, so the visual medium isn't exactly how I best communicate. So bear with me while I go through this. And all right, I'll just start going now. So the history of drug journalism in America, it's really important to understand because it casts a shadow over our present day. And it's important to see how we got to where we are now. And so from the outset, racism and fear and panic has been kind of the key elements in floating around the atmosphere of this topic. So trigger warning, this is a racist slur, and this is a New York Times headline from 1914. And this is the same year that America passed the Harrison Narcotics Act, which is one of the first laws in the country to ban and prohibit and tax and basically start to regulate and also criminalize cocaine and opium. So right off the bat, we have racism and fear of Black people connected to harsher drug laws. Fast forward to, in the 80s and the 90s when there was a so-called crack epidemic, again, the Black community was taking center stage at this time, even though we know now today that white people used far more cocaine than Black people. White people even use far more crack cocaine than Black people, even though it shouldn't matter. Crack and cocaine are the same drugs. However, legally, this panic, this racism, this fear resulted in incredibly harmful laws where possession of crack was punished at a rate, was punished 100 times harsher than powder cocaine. And then like the mothers of Black children who were using crack and cocaine, they got it the worst. Black women at this time by far were the most villainized and stigmatized people in the media about drugs. And the whole crack baby myth and narrative has turned out to cause lasting harm. And so this is just like a look at how the how just influential the media's role is in creating panic and fear about drugs. Again, trigger warning. I'm sorry, these headlines are brutal. Like they're absolutely racist. And again, what we're seeing is the connection of drugs to minorities, to immigrants, and drumming up fear about drugs and crime, drugs and crime. The media really hammered in this notion that wherever drugs are around, there's crime around. And the people involved in drug use are criminals. And whether it's Black people, whether it's Mexican migrants, whether it's Chinese and opium, this is how the media has, from the outset, really connected drugs with crime with minorities. So today, America's in the midst of a brutal overdose death crisis. There are more and more overdoses happening, despite billions of dollars and tons of effort to contain the overdose issue. It's not really going well. We are in the midst of some of the highest overdose death rates on record. So I'm just going to talk about how I cover this crisis in the shadow of that history, but how I cover it with medicine and science and humanity at the forefront. So this piece is a piece I wrote in New York Magazine's political vertical. It was right before January 1st, 2021, right before the new year. The Centers for Disease Control and Prevention, our kind of premier public health agency in the US, they put out two very alarming reports about overdose deaths, how they are significantly rising, and also how COVID-19, the pandemic, is accelerating overdose deaths. And so here is a very newsy lead. That's what I call it. This is the introductory paragraph to the news story. It's very blunt and explicit, very numbers heavy. It's very much just the facts. And I think communicating things this way, it's better, but not perfect, because a lot of people do not understand just how big these numbers are and how many preventable deaths this really truly is. But here I'm just really trying to capture the problem in a medical and public health context. And I'm not talking about crime. I'm not talking to police about this issue. I'm really just quoting the public health and the statistics and the evidence about what we know about this problem. And here is a graph just to kind of show how dire things are from one of those CDC reports. 2020 is estimated to have had 83,000 overdose deaths. This is just a truly shocking number. And I will show you now how it's not just opioids. We tend to hear, at least in the US, how we're in the midst of an opioid epidemic. This is a chart showing psychostimulants, which usually refers to methamphetamine. In the Philippines and I believe other areas of Southeast Asia, they'll call this shabu. And so methamphetamine is on the rise. And as you can see, over the last 4 or 5 years, it's a steep rise. And this tells us that it's not just an opioid epidemic. We have overdoses from illicit fentanyl, which is a potent opioid. We have cocaine, we have methamphetamine. We sort of have just a huge amalgam of illicit drugs, widely and cheaply available. And without education, without better interventions, without focusing on harm reduction and public health, this problem is going to keep getting worse. And that's really what my reporting covering this crisis is trying to show, is that what we're currently doing, pursuing a drug war, is not working, and that what we must do instead is truly center health and evidence and reason and compassion to fix this problem. And so that's really what I'm doing in this slide here. This is the same story about those two alarming CDC reports I wrote for New York Magazine. Here I'm criticizing the drug war approach, and I'm doing so by quoting a very prominent expert. Her name is Dr. Kim Sue, and she is a professor on faculty at Yale University's Medical School in Addiction Medicine. And she is also the medical director of the Harm Reduction Coalition. And here she talks about what she wants to see and how important it is to stop relying on jails and incarceration and costly investigations into drug rings and all these things that the U.S. doesn't only do, but that the U.S. does, and also through international laws and diplomacy and cooperation sort of exports this model to other countries. So the U.S.'s approach, for better or worse, is quite hegemonic. And when we are locking people up for using drugs, absolutely other countries take our cues from us. And so Dr. Sue here is really criticizing the drug war approach. And I'm doing it in a way that I hope is evidence-based, that is convincing, and that educates readers that there is a better way of doing things that can save lives. And so I wanted to also point out this really important study that I think kind of captures a lot of what I just said. So over a 10-year period, researchers at Johns Hopkins University, they analyzed over 6,000 news articles and just found tons of stigmatizing language and inaccurate information. And they concluded, based on this study, that raising the journalistic standards on this topic, really destigmatizing the language of addiction, is a public health priority. In America especially, people learn about the world through the news, through media, through pop culture, and it's here where a better narrative, where compassion, where using evidence to tell stories can really have a tremendous impact on the debate and the discourse overall. So it truly is a public health priority for the media to do better. And this isn't just like political correctness and language policing. The research truly does show that when people are referred to as drug abusers and junkies, that it elicits negative attitudes and bias. And I think it like taps into that long history that we have of equating drugs with crime and equating people who use drugs to criminals. And I think that impulse, that reflex is drawn out when people are presented with terms like drug abuser, because like the term abuse, it's not a good thing, right? Child abuse and spousal abuse, like these are crimes and they cause tremendous harm to people. Whereas drug abuse, putting it in that category does not make sense. So if you want to destigmatize something, you don't want to destigmatize abuse, right? So we need to use different language. So substance use disorder really kind of is the main clinical way to discuss this, and that's definitely how it appears in the scientific literature. You can say drug addiction. It's like anything that avoids labeling people as abusers is probably better. And again, here's a slide from Changing the Narrative. I'll get into Changing the Narrative a bit later, but this is the kind of work that we try to do. We try to prevent alternatives. So, do not use addict and junkies, just call people. I think that's, we get all caught up in labels and identities and all these things. And a lot of this can just be avoided if you just refer to people as people, because even people who use drugs are people at the end of the day, right? And so, and there's other things that we try to kind of change in terms of language. Like we don't like saying clean needles because that implies there's dirty needles. It's just say used needles or unused needles, or a like dirty drug test, and then as opposed to like your urine being clean. It's just getting out of these binaries, getting out of these categories is really important, especially when people in recovery in the US often say, I've been clean for 7 years. It makes it sound like those who are not clean are dirty. And so we really just want to avoid these good, bad, these light, dark, these binaries. I think they really do stifle the framework, and we could really open up the discourse and the dialogue to much more complex and humane and compassionate ground if we avoid these dichotomies and binaries. So real simply, I just have three really basic ways that I approach this topic as a journalist. First, I always consult the research and the evidence. I use Google Scholar a lot. I read all the latest publications in the scientific literature as I can. I know which researchers to look for. I follow all their work. Follow them on Twitter too. That Twitter has probably been the best way for me to actually see what the latest research is, and it helps to follow these scientists and these researchers and these doctors and these public health professionals, because they're constantly sharing information. And me being a journalist, I need that information, and I need it quickly and as easy as possible access wise. So really the scientific evidence is key to just everything I do. And then next, I basically always put forward the argument that the way our current approach works is really not working. As you can see, the overdose death rates are going higher and higher and higher. And so we really truly need a different approach. So I'm not afraid to challenge people's assumptions, to challenge the status quo, and really question the impact of laws and policies and ideas. Even if they're dominant, even if a lot of people think they're popular, they could still be bad. They could still be causing harm. So don't be afraid to go against the grain and question core assumptions. And then lastly, it all comes down to trust. Without people who use drugs willing to speak with me and share their stories and trust me with their story and trust their very difficult, dark times and experiences in my hands, then I don't have a story to tell. So at the baseline, the most important thing for me is that the people I'm talking to trust me. And it's because I've been doing this for years. It's because I have some of my own drug use and addiction experience that I'm open about. And it's because I have people vouching for me, other people in this field who will say, no, you can talk to Zach. He's not going to burn you. He's not going to stigmatize you and judge you. He just really wants to tell your story. And I'm so grateful that I have that, because without that, I would not be able to do this. And so again, I just want to highlight some of the evidence here that I've been talking about why and how the dominant approach, drug enforcement and interdiction, incarceration, how this does not work. This analysis from Pew in 2018, it's sort of a research and data firm in Washington, D.C. So drug arrests and imprisonment rates do not correlate. So there's no significant relationship between drug imprisonment rates and overdose deaths and drug arrests and rates of drug use. These things just do not correlate. So harsher prison sentences and more drug arrests and more people in prison does not solve our drug problem. So we've really been misinformed and going in the wrong direction on this for decades. And so this is just the facts. This is just what the research tells us. So it's so clear that we need a new approach, but yet it's so hard to change these old habits. And this is just kind of visually demonstrating what I just said. Tennessee has a much higher drug imprisonment rate than New Jersey. And on the right, as you can see, the rates of drug use are almost the same. I mean, so thus we conclude again that putting more people in prison does not affect the overall rate of drug use. And what are the point of drug laws if not to prevent people from using bad drugs? I mean, just on its own terms, these laws and approaches do not make sense. So we really need to challenge them and call them out as what they are. You know, there's one side to the story here, and it's that arresting a lot of people does not help solve drug use or drug addiction or any of the problems that we're trying to solve. And so, you know, I only have a couple minutes left here, and I just want to go through these slides that show just how bad the stigma is presently. Here I had to block out those faces to put this in the slideshow because the police department that took this photo did not blur the faces, not even of the toddler in the back seat. So this is a mother and a father who are falling out from overdoses. And this picture went live on a police department's Facebook page. And then the news grabbed it and ran with it. And so I just thought it's just one of the most stark and frankly most stigmatizing thing I could possibly see. And so this stuff is still happening, and it truly does need to stop because it causes so much harm. And then another thing I constantly see is police officers being quoted as experts on drug use and addiction. Here's just a really silly one. A homicide detective basically just called up a journalist and said, hey, I know that people who use drugs are abusing Narcan, quote unquote. And Narcan, it's an opioid antagonist. Nobody who is using opiates wants Narcan. And so just this whole story doesn't make sense, and it didn't need to be written. And had these journalists talked to someone who actually knows the science and of addiction and knows anything about health and the brain and drugs, would know that this is not a story that they should have ran, but they ran it because the sole source was a police officer. And again, this is back to what I was saying moments ago, how harm reduction, the act and idea of making drug use less risky, of trying to connect people who use drugs to services that save their lives and help them survive their drug use and addiction, it gets such a bad rap. It's often blamed for crime and for more syringes on the ground and all these things. And really, the logic is backwards. It's that there's so much inequality and there's such a lack of infrastructure and there's so much policing and truly negative trends happening in our cities right now. And harm reduction steps in to help those people, but it's often blamed for creating more problems. So that was my alarm. I'm 20 minutes in. I'm just going to rip through this. So I'm part of a group called Changing the Narrative, and we do presentations like this to help change the discourse and dialogue about drug use and addiction. And we really are trying to inject science and information and health into the discourse. And we're trying to pull addiction and drug coverage out of the crime vertical and out of the crime debate and put it in a health context, and where compassion and medicine and science are all there to help people. Okay, and so this is where you can contact me. I'm on Twitter at Zach Wright Stuff. You can email me on my Northeastern email right there, and my website, my personal website, where you can click through my stories and my recent work is right there. So thank you so much for listening, and I will definitely be looking forward to the live Q&A. Thank you.
Hi, Zach. Thank you. Let me just give a quick rundown of what you discussed earlier. I really appreciate the careful language and trigger warnings, and it's really aligned with your talk earlier. And going back to the summary, you talked about how media connected the drug crisis to certain people groups, how data story in its presentation affects how the news is perceived and criticized. And you briefly talked about criticizing the drug war approach in your New York Times articles. And it comes to a very careful core message that reporting on drug use requires extreme care. And we have to stick to first person language. We have to refer to them as people, and we'll have to stick with the clinical and medical terminology to avoid stigmatizing or further stigmatizing the people. And this is quite important, not just for media practitioners, I guess. This extends to social media managers, our influencers, I guess. Here in the Philippines, our service hubs for HIV also manage their social media pages, and they sometimes use stigmatizing language in their accounts. Um, this extends to our friends and community members, even to us. We have here um, an expression, adik ka, but it's just an um, expression of surprise or um, just being uh, taken aback by someone's expression. But it's also stigmatizing. I just realized this extends to all of us. This is not just for media practitioners. I appreciate that. I I want to be very careful about this because you also shared about your personal experience and exposure to it.